Oh man, it's been such a long day at work chasing all those sticks and my back sure is hurting me. What's this? Ibuprofen? I'm going to go talk to the nurse and ask what this is.
Well, Battles, you have two options. You can take an aspirin NSAID or non-aspirin NSAID. NSAIDs are non-steroidal anti-inflammatory drugs. Battles, I understand you came in today because your back is hurting you from playing too much fetch.
Yes, why, yes it is.
It's great that you brought this bottle of ibuprofen in today, because that is exactly what I was going to suggest that you take for your pain.
Is that so? So what kind of drug is ibuprofen?
Called non-steroidal anti-inflammatory drugs, or for short, NSAIDs. There are actually two groups of NSAIDs. The aspirin NSAIDs, which can cause an irreversible inhibition of cyclooxygenase. The other group is called non-aspirin NSAIDs, which include medications such as the ibuprofen you have, Advil, Motrin, Aleve, and Celebrex. There are two generations of non-aspirin NSAIDs. First generation NSAIDs inhibit COX-1 and COX-2. Second generation NSAIDs inhibit only COX-1. But due to the risk of MI and stroke, second generation NSAIDs are no longer used.
I'm a bit confused. How the heck does this work in my body?
I'm sorry, Battles. I should have realized you probably didn't learn this stuff in puppy school. NSAIDs work by inhibiting cyclooxygenase.
What on earth is that?
Cyclooxygenase, COX, is found in all tissues and helps regulate multiple processes. COX helps with the promotion of inflammation and sensitizes receptors to painful stimuli. In the stomach, it helps to protect the gastric mucosa. In platelets, it promotes the synthesis of compounds, which stimulates platelet aggregation. In blood vessels, it promotes the synthesis of prostacyclin, which causes vasodilation. In the kidneys, it helps synthesize compounds which promote vasodilation and therefore maintain renal blood flow. In the brain, COX-derived prostaglandins mediate fever and contribute to our perception of pain. And in the uterus, COX-derived prostaglandins help promote contractions during birth.
Miss Nurse, are aspirin and non-aspirin NSAIDs the same thing?
Well, there's a bit of a difference between aspirins and non-aspirin NSAIDs. Aspirin is a non-selective and irreversible inhibitor of cyclooxygenase. Aspirin is indicated for reductions of inflammation, pain, and fever, a result of inhibiting COX-2. It also protects against MI and ischemic stroke, a result of inhibition of COX-1.
Is there any time I shouldn't take aspirin?
Patients with peptic ulcer disease, bleeding disorders such as hemophilia, vitamin K deficiency, and clotting disorders, and hypersensitivity to aspirin itself or other NSAIDs should not take aspirin, and for these patients it is contraindicated.
Okay. And what about non-aspirin NSAIDs, like this ibuprofen that I have here?
Non-aspirin NSAIDs were made in an effort to produce aspirin-like drugs with fewer GI, renal, and hemorrhagic side effects. Non-aspirin NSAIDs also inhibit both COX-1 and COX-2. However, unlike aspirin, these drugs cause reversible inhibition of COX. These drugs are indicated to treat inflammatory disorders such as rheumatoid arthritis, osteoarthritis, and bursitis, alleviate mild to moderate pain like the discomfort that you are feeling now, Battles, suppress fever, relieve dysmenorrhea. Unlike aspirins, this group of NSAIDs do not protect against MI and stroke and actually increase the risk for thrombotic events.
Okay, so how might you say I would take these NSAIDs?
To absorb these in the body at home, you will take these orally both for aspirin and non-aspirin NSAIDs. If you were in the hospital, you might receive the non-aspirin NSAIDs through an IV, or if you were NPO, you might receive aspirin rectally. Onset of action for both categories of NSAIDs occur within 30 minutes after absorption. The peak will be reached between 1 and 2 hours. Duration varies between aspirin and non-aspirin NSAIDs, but it generally is between 4 and 6 hours. Both meds are distributed in the body 90% of the time, bound to plasma proteins. Both groups of NSAIDs are metabolized in the liver and excreted by the kidneys through the urine. However, non-aspirin NSAIDs do not cross the placenta to enter breast milk. However, aspirin does cross the placenta and enter into breast milk.
So how much should I take?
For non-aspirin NSAIDs, for use as an anti-inflammatory, oral dosing is 400 to 800 milligrams, 3 to 4 times per day, with max dose of 3.2 grams per day. For aspirin NSAIDs to be used for arthritis, the dose is 3 grams per day in divided doses between every 4 to 6 hours.
Is there anything specifically that I need to know about these medications?
Patients who take NSAIDs need to avoid alcohol ingestion because they are at risk for GI complications. Because of the involvement of the liver and the kidneys, patients need to report changes in urinary output and blood in the urine. Patients should inform their healthcare providers if they are taking NSAIDs because their tendency to react with over-the-counter products and prescription meds that contain other salicylate. Any patients planning or possibly pregnant should notify prescribers when given non-aspirin NSAIDs, and no type of NSAID is safe for use during the 3rd trimester of pregnancy.
Oh, you mean like my girlfriend right here?
Yes, just like your girlfriend if she gets pregnant. As nurses, we must monitor liver and kidney functions through lab tests like bilirubin, creatine, BUN, CBC, HCT, HGB, and PT, especially if the patient is on long-term med therapy. We must constantly monitor patients' pain levels and watch for any type of allergic reaction, which may include rash. We must keep an eye on the heart, checking for changes in heartbeat or rate. We assess for GI complications, and our goals are to evaluate for decreased pain, inflammation, and fever.
Are there any drugs that I can't take while taking NSAIDs?
There are many drug-to-drug interactions, some of which are with thrombolytics, anticoagulants, and salicylates, and alcohol. Both types of NSAIDs will interact with medications for hypertension, which include calcium channel blockers and diuretics.
Boy, oh boy, thank you so much for this information. I'm gonna go home and share this with my pregnant girlfriend.